All right, so we're going to continue where we picked up on our last video. So we were discussing the CFI and the question, what troubles you most about your problem? Again, you're going to see that this is really more, what's the word? This is really sort of flows into even how you could structure a lot of your intake questions. But what happens is we're trying to really focus on what about the problem is most important to our client. Now, think about this if we look at symptoms from a diagnosing standpoint. Okay. So, if I've got a client who's coming in for anxiety, they may, and I look at the criteria for the DSM, right? And I can see clearly that I'm going to diagnose them with anxiety. There may be certain symptoms in that anxiety diagnosis that are more detrimental to that client. And that's where this is helpful. Is like what part of your anxiety is really most impactful to you in your everyday life? Okay. So it helps us to look at what symptoms may give our client the most relief the quickest. Um, so, some other questions that are helpful is how would you describe your relationship to um, your parent? Okay. So, maybe this is a child coming in. How would you describe your relationship with your mom? And then, if they can't really give you anything, you could probe a little deeper like, how often do you see your mom? How often do you talk to her? How often do you play games, right? Just depending on the age of the child. And then the next question really moves into the culture piece, which is what brings your family or friend here today? Okay. So maybe, um, let's say you're talking to the parent. Why is it that you're bringing in this child? Um, and it says here that sort of a rewording. People often understand problems in their own way, which may be similar or different from how your doctor describes it. How would you describe your child's problem? How would you describe your spouse's problem? Okay, so again, we're trying to get a sense of this whole system of how they view, quote, the problem. And again, in this case, the problem is whatever is bringing them to therapy. The CFI also has a bunch of modules that can help specifically for children, all age groups, immigrants, refugees. So, as you go through that section of the book in the back of the DSM around page 187, 167, 168, around the back, you're going to start to see different modules. And again, you can find something for your client that fits their needs the best. There is what we call an informant version, which I may touch on later. But the informant version is like if I am a parent, if a parent bringing a child, it's the same questions, it just rewords it. So again, it's going to give you the script to be very specific for the population that you're serving. Okay, so let's take a look at these, okay, that we just went over. What problem brings you here today? So, what I want for you to do is I'm going to go over these questions. I'm going to ask you to pause your video and I'm going to ask you to go through this activity. So, if you have your piece of paper, going to go ahead and just draw yourself out a square that looks similar to what I have on the screen. And I want for you to, in the top left, I want for you to pick something from your Brave Play kit. Again, you've got that PDF. I want you to pull it up. And I want you to pick something that can represent a problem that you have. Okay. So we're going to take this from not about a client, but for you individually. So maybe it's anxiety. Maybe you struggle with anxiety. Maybe you struggle with seasonal depression or major depressive disorder. Maybe you're having issues in balancing and transition in graduate school. Okay. Whatever it is, pick a problem that's relevant to you. We're going to use this problem all the way through the rest of our time together. So, describe how you would describe your problem. So, I want you to pick something. So, let's say I'm doing anxiety. And I've picked this little tarot card with all the swords in the heart. Okay. And maybe my problem is anxiety. And this is what I have picked to represent my anxiety. Okay. Maybe I picked a couple of things, but just to show you, you may pick 3 or 4 things, but I'm going to pick one. And then what I'm going to do is write down what about this stuck out to me. So I'm going to pick this. I'm going to write down what I picked. And then I'm going to write down 2 or 3 sentences about that. Okay. Your next question is going to be, how would you describe your problem to your family, friends, or your community? So again, you're going to answer that. I would describe my anxiety to with my family. Um, I usually just say I'm stressed out, or I usually just say I can't focus. Okay. How do you describe it to maybe I even say my community? Nobody in the community may really know that I have anxiety. It hasn't come up. Or maybe it's I had a panic attack at McDonald's last week and I was really embarrassed. Okay. So again, we're going to answer that. You're going to pick something that would describe how I would describe it to my family. So maybe I have picked this little flower vase, this little planted flower, because maybe I just present it like it's not a big deal and minimize it with my family. Okay. The next question is, what troubles you most about your problem? So you're going to pick something that describes what bothers you most. And maybe I picked this ice cream cone because it maybe my biggest fear is that I'm going to melt down. Okay. And then the next question is, how big is your problem? Now, this is where I'm going to teach you another activity here whenever we come back from pausing it. But how big is your problem? So maybe I picked this little tree stump because I'm like, it's so big. It's like big as a tree. Like, think about the biggest tree you would know. And that's how big it feels in my life right now. Okay. So you're going to write those down. So I'm going to pause the video here. Have you pause it? You should be able to still see the questions on your screen when you pause it. You're going to fill out your 4 boxes, and then we're going to come back and talk a little bit about how to process those as well. Okay, so you should have paused, done the activity, and now you're coming back. So you're going to have your 4 squares with your, you have picked one of your Brave Play pieces off the screen, and then you've written about them. Um, what does this give us? It gives us an idea of not just what the client views the problem outside of like a medical diagnosis, but how it impacts them. And the other piece is, how is it that they're communicating with their support or their community or their friends? Are they in isolation? Do they have some support? It's going to give you a good idea of protective factors. Now, I want to talk about how big is your problem, because another great way to do this, even with adults, is to put this in visual. So, what I like to do is have some kind of like jar of beans or rice, or if you have a sand tray, or it could be, it literally could be anything that you can stack, Jenga pieces, whatever. So, how big is your problem? Another way you can do it is you could have dinosaurs, and you could have a small, medium, large, gigantic. And for kids, having a visual of, okay, how big is your sadness when you're at school? How much sadness do you have? So you can get an idea for them. They can look and they can like, well, it's not the small one, but if they go to the really huge extreme one, it gives you an idea of where they feel like they are on the spectrum. It's the same for adults. If I do it in sand tray, or if I do it with rocks, I may have them, I may write the word, in my case, anxiety on an index card. And maybe they also have some sadness. Um, and I'm going to write their symptoms on the index card. And I'm going to have them pile up the beans or the rice or the sand on the index cards, so I can give good visual of which is overwhelming. Okay. So again, that's just a visual for a lot of our right brain people. That can be very helpful because if you say pick a number between 1 and 10, a lot of times they it may just be that they can't articulate exactly how heavy it is or how light it is. Most people do well with the physical manipulation. Okay. All right. So when we talk about diversity in play therapy, I think this applies to no matter if you view yourself as someone who does play or works with children or you work with adults. But Dr. Gill says there is a consensus that the first step in becoming a cross culturally competent therapist is to develop an understanding of your own ethnic identity and your culture's values. So you're going to see this across the board in the research is that it's so important for us to understand who we are as individuals to even be able to be culturally competent in our sessions. So this is the author of the CFI who's done all the research on it, and he says that the cultural context and expectations frame the clinical encounter for every patient. So they're bringing this into the room. So addressing cultural issues and cultural strengths is essential to have a comprehensive psychiatric assessment. We can't not bring it into the room. It's so much of a core, so much our values, what we believe about the world that we live in is so vital to mental health. Um, and the other piece is that we have to develop and expand on our insights. Okay. We can't just do it one time and be done for many reasons, but one is because every client's a little different. But it's this really circular motion of learning more about myself, gathering more information, making shifts, gathering more information, making shifts, adjusting my clinical care, adjusting my internal worldview. Okay. This isn't a one and done. This isn't I explore my culture and I'm done because our values and our culture is always shifting just as it is for each of our individual clients. So this is the starting point. This is not the end game for us. All right. So let's talk about what makes up your culture. Okay. So here's a directive. So what we want to start by doing is the first thing is we've already talked about this a little bit, but you're going to define your problem. Okay, so pick a problem that is relevant to you. Okay, if you don't have a problem, good for you, but I would say maybe you need a little more insight. But you got something that you probably want to work on. Okay, if you need to borrow a problem, you can borrow anxiety. Okay, but define what your problem is. I want you to write that down on your piece of paper. Okay, so I'm doing anxiety, so I'm going to write anxiety down. Problem equals anxiety. Okay, all right. So here's our prompt that we already looked at. So I'm going to give you the prompt, and you're going to expand on maybe what you already have because you've already started this process. I would like to understand the problems that bring you here so that I can help you more effectively. I want to know about your experience and your ideas. I will ask some questions about what is going on and how you are dealing with it. And please remember there's no wrong or right answers. Okay. So this is the prompt the CFI gives you. Very clear. So if you're nervous, read the prompt off the piece of paper. It's okay. But at some point, you're going to figure out how to pull the right threads for your own intake. And when you start asking these in session, you're going to figure out a way that flows with how you're going to do it. It will happen with time and with more practice. Okay. All right, so now we want to look at how does your culture define your problem? Okay. So we've talked about this. How would you define or describe your problem? Um, so again, mine is anxiety. So how would I describe my anxiety? So the client's going to give you their symptoms. That's what's happening here. Okay. And then we've already talked about this before. How would you describe your problem to your support system? How do you describe it to your family? How do you describe it to your friends? Anybody else in your community? Community could be a pastor, community could be a coach, right? It could be a yoga teacher, it could be your person at your favorite store you visit. So how would you describe your problem to them? Now think about this. Maybe you're very closed off and you're not telling anybody that you have this problem. If you were to tell them, how would you describe it to them? And then the final question is, what troubles you most about your problem? Okay. All right, so we're going to pause the video here. I'm going to let you expand on this just a little bit. And then when you're ready, you can unpause it and we'll start the video back. Okay, so now we're back. All right, so now you have your questions. Now remember, a great way too is also to go back to the Brave Play and pick things. So when we're doing the right brain activity, the way that you would want to follow that is you want to have them pick something from the Brave Play kit, or pick something from the sand tray, pick something from around your house, like a little scavenger hunt, and then, or pick it off of the PDF I provided. And then you want to write. So anytime you're having, I didn't explain this earlier, but anytime you're doing this, you want to have a client to pick something, right brain, pick something tangible, okay, and then write about it. Or if you're not having them write, you can have them talk about it. A lot of times in session, later after the intake, if I'm doing an activity that's right brained, I will have them pick it, write it, and then we'll talk about it. But for the intake, I would not do that, or for the very first few sessions, okay? But for this case, we're also not talking because this is a video, but you're going to pick it and write it, okay? So you should have these done. All right. Now we're going to move on to the causes of the problem. Now, this is where you can really start to see how someone's worldview and how the culture they were brought up in impacts what they view as the cause of their problem. All right, so here's the questions that you're going to answer. Why do you think that this is happening to you? What do you think are the causes of your problem? Okay, so for my example, why do I think that I'm having anxiety? What do I think are the causes of my anxiety? Okay, so you're going to pick something from the PDF or from your house. You're going to pick something from the Brave Play kit, and then you're going to write about it. Okay. Now, a further prompt, if it's needed, could be some people may explain their problems as a result of bad things that happen in their life, problems with others, a physical illness, a spiritual reason, or many other causes. Okay. So again, the prompt is help them. If they're like, I don't know, then you could give them the prompt. Then the next question that I want you to answer is, what do others in your family, your friends, or others in your community think is causing your problem? So now we have originally how they view the problem, and now why do they think you have the problem? Okay. So you're going to pick something and then you're going to write down your answer. So I'm going to pause the video here, and when you're ready, you can unpause it and then we'll continue the dialogue. Okay, so now we're back. You should have answered these questions. So what one of the things that's interesting I want to point out here that comes up many times is, what do others in your family or your friends or in your community think causes your problem? So just an example. So I grew up in a very conservative, religious, very dogmatic church. And it was viewed for my whole childhood that if we take the problem of anxiety, that you would hear the phrase a lot, well, you just got to give it to God. Okay. And that mental illness of any sort was viewed as a flaw. There must have been some type of sin that is causing you these problems. but that if you are in strong relationship with God, that you would not have these problems. And I know that that's a common thread that gets pulled through a lot of religious groups. And so that could be a thing that would come up here is what do others in your family think? Well, they may view it as a character flaw, that you need to toughen up, that you need to, put your big girl pants on, right? These are phrases that I would hear. So that is helpful for a lot of reasons. One is because that probably has become an inner dialogue of a client, and we're going to help them shift that inner dialogue. But the other is it also could show you how much support they have in their external system. So now we're again going back to protective factors. That may not be a protective factor that they have right now. So if that was a client that was younger, or even, even an adult, that may mean that as a therapist, I'm having some family therapy to explain what's happening from the mental health perspective. So I can maybe get that support system on board with what's happening and with treatment. Okay. All right. Next slide here. All right. So again, this is just a visual that we talked about. So for those of you who need to see it a different way, this is a visual. So again, I may have a client, you could print this worksheet. You may have a client go in and place the Brave Play atoms or the sand tray miniatures in each square as well. So now we're going to move into the part of the CFI that's stressors and support. Okay. So the next questions that you're going to answer on your paper is going to be, are there any kinds of support that make your problem better, such as support from a family, friends, or others? And then, are there any kinds of stress that make your problem worse, such as difficulties with money or family problems? Okay. So again, our next question, you're going to pick something from around your house, from your sand tray miniatures, from your Brave Play kit, or on the PDF. And you're going to pick something, one or two things that make your problem better. So for me, it would be like, what makes my anxiety better? Okay, I'm going to pick these and then I'm going to write about them. Okay. And then once you're done with that, you're going to move on. What makes your problem, or for me, my anxiety, what makes my anxiety worse? I'm going to pick some things and then I'm going to write about it. This could take you 15 to 20 minutes. Okay. So don't worry. You're going to pause the video. It'll keep the questions up on the screen. And then once you're ready, you can come back and we'll move to the next set of questions. Okay, so you should have now come back and you've answered these questions. Are there any kinds of support that make your problem better? And then are there any kinds that make your problem worse? Okay. So again, this has given you a lot of real good data for what coping skills does the client have, what resources does the client have, that maybe things they've already tried, which we may talk about a little bit later. So you're getting a real good overview of what's happening. Another thing that can be helpful, and there may be a better place ahead to talk about this, but I'm going to go ahead and talk about it right now. When we think about creating a diagnosis, okay, and we've got our symptoms, the things that you want to ask about a symptom are the following. So you're going to want to write these down. I didn't put these in the PowerPoint, but I think it's so important for us at this beginner stage, learning about diagnosing. The first one is the onset. When did the symptoms start? So maybe I have anxiety. Okay, so I'm going to flip in my DSM to my anxiety. Okay, and just I know this isn't about diagnosing necessarily, but if you have not done this, which if you haven't had DSM yet, you haven't. But if you haven't tabbed your DSM, you totally should tab your DSM because it makes it way easier. So across the top, I have tabs. These are just the little cheap sticky notes that you can get. They're very, very flexible. because I like these because they won't rip your pages. If you get the really thick ones, like you can buy tabs already pre-made, they tend to rip your pages, but these will not. They will fold super easy. I put the diagnosis at the top that we use the most often. And then on the side, like these are the chapters, and then the individual diagnosis on the side. And I don't label every one of them, but I label most of them. Okay. So I know, okay, I can find anxiety, and then I go to the anxiety category, and now I'm going to find generalized anxiety, okay, which is also called GAD. So let's look at the criteria, okay? So for each criteria, I want to know a couple of things. I want to know onset, ONSET, okay? So when did these symptoms start, okay? So let's just look at, for example, criteria B. The individual finds it difficult to control worry, okay? So when did it start becoming difficult to control the worry? Okay. Well, I don't know. It's always been that way. Okay. Well, then the next question I'm going to ask is, when can you remember when it wasn't difficult to control the worry? So now I'm looking for the exception. Okay. And maybe they're like, I've always been that way. Okay. Well, then when was the time that it was a little better than what it is right now? Okay, so again, I'm just trying to look for that time period. Well, it wasn't as bad last summer, but it really started more whenever I started this new job. Okay, great. So when did you start the new job? Okay, a year ago. Okay, so the onset could be a year, but I'm also going to mark client reports. They've always had worry, but over the last year, it's been more. Okay. All right, so anxiety and worry are associated with 3 or more of the 6 symptoms. Okay, so let's just pick a symptom. So difficult concentrating or your mind going blank. Okay, when did that start being a thing? Okay, 6 months ago. Okay, so my onset is 6 months. Okay, what is the in frequency that happens? Is it happen all the time? Does it happen 3 times a day? So I want to get an idea of the frequency of that symptom. I want to get an idea of when you do have it, what is the duration of it? How long does it last? Maybe it lasts for an hour or two every time it happens. Okay. So the duration. And then I want to get an idea of the intensity. On a scale of 1 to 10, how difficult is it usually? Okay. And then I want to know how long it lasts. So we have onset. When did it first start? The frequency, how often do you have it, the duration, how long does it last, and the intensity. When you do have it, how intense is it? Okay. The reason these are important is because they're going to help you know when the symptoms are getting better, but it's also going to help you know where to get the quote biggest bang for your buck. So if I've got 3 symptoms that are happening all the time and that are super intense, my protocol or my treatment plan is going to focus on those as the priority, because maybe I do have muscle tension, but maybe it's not often, and maybe it's not very intense. Okay, well, then that may not be where I'm going to get the biggest, exchange for my time. So focus on the symptoms that make sense, that can give the client the most relief. Okay. All right. So that's going to help you to form a more true diagnosis for that specific client. All right, so on these questions, are there any kinds of stress that make your problems worse? Okay, so again, we're getting an idea of what extra external factors, or maybe it's internal dialogue. So can we remove some of those stressors or set boundaries in place that can help, that may automatically reduce the symptoms of the problem, in this case, in the anxiety? Okay. All right, so we're going to pause this video here, and you're going to go ahead and go to part 3, and we'll start looking at what's next.